In their latest attempt to combat vaccine hesitancy in Black communities, the Leon County COVID-19 Vaccination Task Force invited medical leaders to discuss the toll the virus takes on the young community members we expect to leave the future to.
When I look at the future, if we cannot change this, there is the possibility that we will continue to be disproportionately affected by COVID-19.
FAMU Professor of Epidemiology Dr. C. Perry Brown points out how vaccine hesitancy in adults puts children at greater risk of contraction.
All of our youth from 0 to 11 are at risk because they cannot be vaccinated. And so one potential avenue of exposure would be unvaccinated adults.
Unvaccinated adults may be more likely to die due to the virus, causing an even more startling trend among young Black children.
Black youth make up 14% of the population. Black kids make up 20% of children who have lost a parent to COVID.
Parent and community activist Talithia Edwards says she's vaccinated, but concerned about how unvaccinated interactions affect her youngest children.
I worry about my children who are not able to get vaccinated. So I have 3 who are old enough to be vaccinated, who are all vaccinated. And then, of course, that leaves 5 who are under the age that cannot be vaccinated. And my husband's a school teacher, which complicates a lot of it.
School board member Daryl Jones moderated the discussion and wants parents to play an active role in COVID-19 prevention.
What this conversation is about is how do we move from fear to action.
Action, Dr. Brown says, is part of parental responsibility.
One of the requirements of being a parent is to protect your child. And my advice relative to COVID would be, number one, please get vaccinated.
Participants also discussed COVID-19's impact on learning loss and stunted socio-emotional development. In Tallahassee, Cara Bailey, ABC 27.